What are the key principles of water quality management in aquatic animal care, and why is each important for the health of the animals? Answer: water quality management is essential to the health and well-being of aquatic animals. The key principles include temperature control. Aquatic species are highly sensitive to water temperature, which can affect their metabolism, immune function, and reproductive behavior. Maintaining a consistent and species-appropriate temperature is critical. pH levels. The pH of the water must be monitored and maintained within the acceptable range for the species being cared for. Extreme pH levels can cause stress and interfere with the animal's ability to absorb oxygen and nutrients. Oxygen levels. Aquatic animals depend on dissolved oxygen for respiration. Low oxygen levels can lead to hypoxia, which can stress the animals and make them more susceptible to diseases. Ammonia, nitrite, and nitrate levels. Waste from fish and uneaten food can release harmful chemicals into the water. Water hardness. Hardness refers to the concentration of minerals, primarily calcium and magnesium. Hard water is important for some species' osmoregulatory processes, while others may require soft water. Explain the basic principles of animal husbandry practices for livestock. Answer: animal husbandry refers to the management and care of farm animals to ensure their well-being and productivity. The basic principles include shelter and housing. Farm animals must have adequate shelter to protect them from extreme weather conditions such as heat, cold, and rain. Proper ventilation is also essential to avoid respiratory problems. Nutrition and feeding. A balanced and species-specific diet is critical for the growth, health, and reproduction of farm animals. This includes providing the correct proportions of protein, carbohydrates, fats, vitamins, and minerals. Health and disease management. Regular health checks are necessary to prevent, identify, and treat diseases. This includes vaccination programs, parasite control, and monitoring for signs of illness. Breeding. Selective breeding is practiced to improve desirable traits in livestock such as disease resistance, growth rates, or milk production. Proper breeding practices help maintain genetic diversity and reduce the risk of hereditary issues. Handling and transport. Safe and humane handling practices are vital during transportation and movement of livestock. Mr. Thompson is managing a large commercial farm that includes both cattle and poultry. He notices that some of the poultry are showing signs of lethargy and the cattle appear less active than usual. What steps should Mr. Thompson take to address this issue? Answer: Mr. Thompson should first consider the health of both groups of animals. The symptoms of lethargy in poultry and reduced activity in cattle could be due to a variety of factors such as disease, poor nutrition, environmental stress, or inadequate water supply. Here's a step-by-step approach. Check water quality. Ensure the water supply for both the poultry and cattle is clean and free from contaminants. Poor water quality could be the root cause of lethargy or reduced activity. Assess the feed. Verify that the nutritional needs of both species are being met. Deficiencies in essential vitamins, minerals, or protein could lead to fatigue and reduced activity. Inspect for disease. Mr. Thompson should look for signs of illness or infection such as abnormal discharge, coughing, or abnormal behavior in both the poultry and cattle. This might suggest an outbreak of a common disease like avian flu in poultry or bovine respiratory disease (BRD) in cattle. Environmental conditions. Consider whether extreme weather, poor ventilation, or overcrowding could be affecting the animals. Consult a veterinarian. If the issue persists, Mr. Thompson should consult a veterinarian for a more thorough health checkup of the animals. Why is it important to monitor ammonia and nitrite levels in fish tanks, and what actions should be taken if these levels become too high? Answer: ammonia and nitrite are toxic compounds that can accumulate in fish tanks due to waste products from fish, uneaten food, and decaying organic matter. Ammonia. This compound is particularly dangerous to aquatic life even at low concentrations. It can damage fish gills, impair their ability to absorb oxygen, and cause neurological damage. Ammonia levels above 0.2 ppm can become toxic to many species. Nitrites are a byproduct of ammonia breakdown, and high nitrite levels can interfere with the fish's ability to transport oxygen in their blood. This condition is known as methemoglobinemia and can cause suffocation in the fish. To maintain water quality, regular monitoring. Regularly test ammonia and nitrite levels in the water using test kits. If levels are too high, immediate action should be taken. Water changes. Perform partial water changes to dilute the ammonia and nitrite concentrations. Filtration. Ensure the tank's filtration system is working effectively. Biological filtration can help break down ammonia into less toxic compounds through beneficial bacteria. Reduce feeding. Overfeeding can increase waste in the tank, so it's important to monitor feeding schedules and amounts. Describe the different stages in the milking process and why each stage is essential for both the cow's health and milk quality. Answer: the milking process involves several stages that ensure the health of the cow and the quality of the milk. Preparation. Prior to milking, the cow's udder should be cleaned to remove dirt, bacteria, and debris. This reduces the risk of contamination. Pre-milking sanitizers are often used to clean the teats. Milking. The milk is extracted using mechanical or manual methods. The milking machine must be calibrated to ensure proper suction without causing injury to the cow. Overmilking or excessive suction can damage the udder tissue. Post-milking treatment. After milking, each teat should be dipped in a sanitizing solution to prevent bacterial infections such as mastitis. Proper aftercare is important for maintaining udder health. Storage. The milk must be immediately cooled to a temperature below 39 to prevent bacterial growth and preserve freshness. Adequate storage facilities are necessary to keep the milk safe until it is processed. What are the specific feeding requirements for poultry during the laying cycle, and why are these important for egg production? Answer. During the laying cycle, poultry have specific nutritional needs to maintain their health and optimize egg production. These requirements include protein. Protein is essential for egg formation and should make up a significant portion of the diet. During the laying cycle, it supports the production of egg whites and the development of the eggshell. Calcium. Calcium is critical for the formation of the eggshell. A deficiency in calcium can lead to soft or thin shells, which may result in breakage during handling or reduced egg production. Energy. Adequate energy provided by carbohydrates and fats is necessary to support the laying hen's activity level and egg production. Energy deficiency can reduce egg size and quantity. Vitamins and minerals. Vitamins D and E, as well as trace minerals like phosphorus and magnesium, are essential for reproductive health and immune function during the laying cycle. By providing a balanced diet that meets these specific needs, poultry farmers can ensure consistent and high-quality egg production. Ms. Evans is caring for a herd of dairy cattle and notices that one of the cows has a swollen udder and is producing less milk. What steps should Ms. Evans take to address this problem? Answer. The swollen udder and reduced milk production are signs of potential mastitis and infection of the udder. Ms. Evans should take the following steps. Isolate the affected cow. To prevent the infection from spreading to other cows, isolate the affected animal from the rest of the herd. Examine the cow. Ms. Evans should inspect the udder closely for signs of inflammation, heat, or abnormal discharge. Mastitis can cause clotted or discolored milk. Consult a veterinarian. A veterinarian should be called to confirm the diagnosis and provide appropriate treatment. This may involve administering antibiotics if the infection is bacterial. Improve milking hygiene. Ensure that the milking environment is clean and the milking equipment is sanitized regularly to prevent further infections. Monitor milk quality. Regular testing of milk samples should be done to monitor for the presence of mastitis-causing bacteria. By acting swiftly, Ms. Evans can treat the cow and prevent the spread of mastitis within the herd. What are the key factors to consider when designing a fish tank or aquarium system for optimal aquatic animal care? Answer. Designing an effective fish tank or aquarium system requires attention to several key factors. Tank size. The tank should be large enough to accommodate the species size and number. Overcrowding can lead to poor water quality and increased stress for the animals. Filtration. A reliable filtration system is essential for removing waste, excess nutrients, and harmful chemicals from the water. This includes biological, mechanical, and chemical filtration components. Aeration. Proper aeration ensures sufficient oxygen levels in the water, which is vital for the survival of aquatic species. Temperature control. The system should have a reliable heating or cooling system to maintain the appropriate water temperature for the species being housed. Lighting. The lighting system should mimic the natural day-night cycle of the species, supporting their biological rhythms and behavior. Substrate and decorations. The tank should have appropriate substrate, gravel, sand, or artificial media and decorations to provide hiding places, support natural behaviors, and enhance the aesthetics. Why is proper livestock transport crucial, and what regulations should be followed to ensure the safety and welfare of the animals during transportation? Answer. Proper livestock transport is crucial to prevent injury, stress, or death during travel. Stressful transportation conditions can compromise the health of the animals and lead to significant welfare concerns. Regulations to ensure the safe transport of livestock include vehicle design. Transport vehicles must be designed to provide adequate space, ventilation, and comfort for the animals. The animals should not be overcrowded, and the temperature should be controlled to avoid overheating or freezing. Travel duration. Livestock should not be transported for excessively long periods without breaks. Adequate rest, food, and water must be provided during the journey. Animal Welfare This act outlines specific guidelines for the humane treatment of animals during transport, including restrictions on travel times and conditions, particularly for animals like cattle, sheep, and poultry. Certification and training. Transporters must be trained in animal welfare and certified to handle livestock transport safely. This ensures they understand the requirements for humane handling and emergency procedures. How does livestock disease control impact farm animal management, and what measures should be in place to prevent outbreaks? Answer. Livestock disease control is essential for ensuring the health of farm animals and preventing the spread of infectious diseases that could impact productivity and welfare. Key measures include vaccination programs. Regular vaccinations should be implemented to protect against common diseases such as foot and mouth disease, bovine tuberculosis, or avian influenza. Quarantine and isolation. New animals should be quarantined before being introduced to the herd to prevent the spread of potential diseases. Any animals showing signs of illness should be isolated immediately. Biosecurity protocols. Strict biosecurity measures, including disinfecting equipment, clothing, and vehicles, should be followed to prevent the introduction of diseases to the farm. Regular health checks. Ongoing monitoring of the animals' health is necessary for early detection of diseases. Farmers should work with veterinarians to develop a health management plan. By maintaining robust disease control measures, farmers can ensure the health of their animals and prevent costly outbreaks. What are the core principles of animal welfare, and how do they relate to the ethical treatment of animals in care environments? Answer. The core principles of animal welfare are based on the 5 freedoms, which are essential to ensuring animals are treated ethically and with proper care. Freedom from hunger and thirst. Providing access to fresh water and a balanced diet. Freedom from discomfort. Providing an appropriate environment with shelter and a comfortable resting area. Freedom from pain, injury, or disease. Preventing and rapidly diagnosing and treating illness and injury. Freedom to express normal behavior. Providing enough space and appropriate conditions for animals to express natural behaviors. Freedom from fear and distress. Ensuring that animals are not subjected to conditions that cause mental suffering or fear. These principles must be adhered to within the Animal Welfare Act 2002 or relevant local legislation which legally mandates the appropriate care of animals. Ethical treatment also incorporates recognizing the emotional and physical needs of animals, ensuring they are not subjected to unnecessary suffering, and protecting them from abuse. Which legal framework in your jurisdiction regulates the treatment and welfare of animals, and what are the key duties of an animal care worker under this framework? Answer. In most jurisdictions, animal welfare acts and codes of practice guide animal welfare. For example, the Animal Welfare Act 2002 in Australia or similar legislation enforces the proper care and treatment of animals. The main duties of animal care workers under such laws include ensuring animals are treated in a manner consistent with their welfare needs, reporting any cases of cruelty or neglect, maintaining a safe and hygienic environment for animals, keeping accurate records of animal health, care and treatment which may be required for legal compliance. An animal care worker is legally required to ensure that animals are not in a state of distress or pain and must have knowledge of proper handling and care techniques. A failure to comply can lead to legal consequences, including fines or loss of professional certification. Mr. Thompson works as a zookeeper at a local wildlife sanctuary. He notices that one of the kangaroos, which had recently been moved to a new enclosure, has been unusually aggressive and shows signs of stress. What steps should Mr. Thompson take to ensure the welfare of the animal, and what laws or ethical guidelines should he consider in his actions? Answer. In this situation, Mr. Thompson should first assess the animal's environment and condition. Immediate assessment. Ensure that the animal is not in pain or injured. He should look for signs of injury, disease, or discomfort that could be contributing to the aggression. Environment evaluation. Assess the new enclosure to ensure it is suitable for the animal. Stress can result from inappropriate space, lack of shelter, or other environmental factors. Animal behavior monitoring. Monitor the kangaroo's behavior over time and consult a veterinarian or animal behaviorist if necessary. Consultation. If the issue persists, it may be necessary to move the animal to a quieter, less stressful environment. Under animal welfare laws, e.g., the Animal Welfare Act 2002, Mr. Thompson is required to ensure the animal's psychological and physical well-being. Ethical guidelines stress that animals should not be kept in situations that cause undue stress or harm. Moreover, as per professional codes of practice, he must take steps to mitigate the animal's distress and ensure its overall welfare. Why is biosecurity important in animal care, and what are the key biosecurity measures that must be followed in an animal care facility? Answer. Biosecurity is crucial in preventing the spread of infectious diseases within animal care facilities. The key biosecurity measures include quarantine procedures for new animals or animals that show symptoms of illness, regular sanitation and cleaning of animal enclosures to prevent cross-contamination between animals, personal protective equipment (PPE) for handlers to prevent the transmission of pathogens, health checks and vaccinations to reduce the risk of disease outbreaks, record keeping to track health status and vaccination schedules for animals. Biosecurity measures are guided by the National Animal Health and Welfare Regulations, which aim to reduce the risk of disease transmission, protect animal health, and ensure that animals in care do not become carriers of contagious diseases to others. Which strategies are most effective in administering medication to animals, and what legal or ethical considerations should be taken into account when doing so? Answer: effective medication administration strategies include proper identification of the animal to ensure the correct dosage is administered, using the right method of administration, oral, injectable, topical, depending on the medication and animal, observing the animal after medication to monitor for any adverse reactions, accurate record keeping of the medication administered, dosage, and time. Under the veterinary medicines regulations, it is a legal requirement that medications are administered following veterinarian instructions and that all records are kept accurately. Ethically, an animal care worker must ensure that no animal is harmed due to incorrect medication and that all animals are treated in accordance with the highest welfare standards. What is the role of animal behavior in determining the welfare of animals, and how can an animal care worker assess and address behavioral issues? Answer: animal behavior plays a significant role in assessing animal welfare, as behavioral signs can indicate stress, discomfort, or illness. Key steps to assess and address behavioral issues include observation. Care workers should observe the animal's interactions, eating habits, and overall demeanor. Behavioral changes often signal problems. Environmental factors. Changes in environment or routine can cause stress, so workers must assess these conditions. Behavioral enrichment. Provide appropriate stimulation and interaction to reduce anxiety and promote natural behaviors. Veterinary consultation. If abnormal behaviors persist, a veterinarian or animal behaviorist may be consulted for further evaluation. The Animal Welfare Act 2002 includes provisions that mandate proper environmental enrichment and psychological care for animals in custody, ensuring their overall welfare is not compromised. What are the common health conditions that animal care workers should be aware of, and how can these conditions be prevented or managed? Answer: common health conditions include parasites. Fleas, ticks, and worms can affect a wide range of animals. Regular treatments and hygiene measures can prevent infestations. Respiratory infections. Animals in close quarters can spread respiratory diseases like kennel cough. Vaccinations and proper ventilation can help prevent outbreaks. Skin conditions. Conditions like mange or fungal infections. Regular grooming and cleanliness can help reduce the risk. Injuries. Sprains, cuts, and fractures. First aid knowledge is essential to treat minor injuries immediately. Prevention involves vaccination programs, regular health checks, and following biosecurity protocols. The National Animal Health Act and veterinary medicines regulations guide the management of these conditions and their prevention. Sophie works at an animal shelter and notices that several dogs in her care have developed severe flea infestations. She suspects that the shelter's cleaning and bedding practices may be contributing to the problem. What steps should Sophie take to manage this situation, and what relevant regulations should guide her actions? Answer: Sophie should take the following steps. Immediate action. Treat the affected dogs with appropriate flea treatment as prescribed by a veterinarian. Sanitation. Perform a thorough cleaning of all areas, including bedding, kennels, and common spaces, using flea-killing disinfectants. Inspection and quarantine. Identify if any other animals are affected and quarantine them to prevent further spread. Review practices, evaluate and improve shelter cleaning and bedding procedures to prevent future infestations. Consultation. Consult with a vet to ensure proper treatment protocols are followed. Under animal welfare regulations, such as the Animal Welfare Act 2002, Sophie must ensure that the animal's health is safeguarded and that they are not subjected to avoidable distress, such as from flea infestations. Proper sanitation and treatment protocols are legally required. Why is record keeping crucial in animal health management, and what are the key elements that should be included in animal health records? Answer: record keeping is critical for tracking the health status and treatments of animals. Essential elements of animal health records include animal identification, name, breed, age, and any other distinguishing features. Health history, details of past illnesses, vaccinations and treatments, treatment and medication. Dates, types of medications, dosages, and any side effects. Veterinary consultations, records of visits and diagnoses. Behavioral observations, Notes on any behavioral changes that could indicate health issues. Proper record keeping is mandated under animal health regulations, ensuring that all treatments and health interventions are documented and traceable, which aids in legal compliance and effective animal care. What are the key considerations for animal care workers when handling animals in emergency situations, and how do these considerations relate to animal welfare laws? Answer: key considerations include calm and safe handling, minimize stress and potential injury to the animal by using appropriate techniques for restraint and care. First aid knowledge, know how to administer emergency first aid, including CPR and wound care. Veterinary support, seek veterinary help immediately for serious injuries or illnesses. Protective equipment, use PPE to ensure safety for both the worker and animal. In emergency situations, animal care workers must adhere to the Animal Welfare Act 2002, ensuring that their actions minimize suffering and provide immediate relief from pain and distress, while also following safety protocols for both humans and animals. How does a thorough understanding of animal behavior help in reducing stress during handling and restraint? Answer: understanding animal behavior is key to reducing stress during handling and restraint. Animals communicate through body language, vocalizations, and subtle movements that can indicate fear, aggression, or calmness. Recognizing stress signals like pinned ears, rapid breathing, or stiff posture allows handlers to adjust their approach, avoiding escalation into aggression. For instance, knowing a dog's calming signals, e.g., licking lips or yawning, can indicate rising stress, prompting handlers to pause or modify their technique. Knowledge of an animal's flight zone is crucial. This is the distance an animal maintains for comfort before it perceives a threat. Approaching an animal too quickly or directly into its blind spot may increase anxiety. Slow, deliberate movements within the animal's tolerance reduce fear and ensure cooperation. Understanding species-specific behavior is equally important. Prey animals like rabbits react differently than predators like dogs. Building trust by using a calm voice and positive reinforcement, such as treats or soothing contact, helps the animal associate handling with a non-threatening experience. Explain the differences between physical and psychological restraint techniques, providing examples where each would be used. Answer: physical restraint involves directly limiting an animal's movements using tools or manual techniques, while psychological restraint focuses on influencing the animal's behavior through environmental or behavioral cues. Both methods are essential but should be applied thoughtfully based on the situation. Physical restraint, such as using a leash, muzzle, or holding techniques, is often used in medical procedures or when dealing with aggressive animals. For example, a veterinary technician might use a towel to safely restrain a cat during a blood draw, ensuring both the animal's and handler's safety. Care must be taken to avoid excessive force, which can lead to stress or injury. Psychological restraint relies on creating a calm environment and using positive reinforcement to encourage cooperation. For example, speaking softly and offering treats can distract a nervous dog during a grooming session. This method is less invasive and often reduces fear-related behaviors. A combination of both techniques is often the most effective approach. For instance, a frightened rabbit might be restrained physically using a towel while being soothed with gentle stroking and quiet surroundings. What are the potential risks of overfeeding an animal, and how can these risks be mitigated through proper feeding schedules and portion control? Answer: overfeeding can lead to obesity, diabetes, and joint issues, significantly impacting an animal's health and lifespan. Excessive calorie intake, especially when combined with a lack of exercise, often results in weight gain, which puts stress on the cardiovascular system and joints. Overweight animals are more prone to conditions such as arthritis and respiratory problems. To mitigate these risks, it is essential to develop proper feeding schedules and portion control. Feeding schedules ensure consistent meal times, which can regulate an animal's metabolism and prevent overeating. For example, dogs and cats thrive on routine and should be fed at the same times daily, with portions calculated based on their weight, age, and activity levels. Portion control involves accurately measuring food portions to meet the animal's caloric needs. Using guidelines provided on pet food packaging or veterinary recommendations helps prevent overfeeding. Additionally, treats should account for no more than 10% of an animal's daily caloric intake. Regularly monitoring an animal's weight and body condition score (BCS) ensures adjustments can be made to maintain a healthy weight. When handling an aggressive or stressed animal, what factors must be considered in order to ensure both the safety of the handler and the well-being of the animal? Answer: handling aggressive or stressed animals requires a careful approach to ensure safety and minimize distress. The first step is observing the animal's body language for signs of aggression, e.g., growling, baring teeth, or stress, G. Trembling, panting. Recognizing these cues allows the handler to predict behavior and respond appropriately. Environmental factors play a significant role. Reducing noise, removing other animals, or dimming lights can help calm a stressed animal. Approaching the animal calmly and avoiding direct eye contact reduces the likelihood of escalating aggression. When physical restraint is necessary, using appropriate equipment such as gloves, muzzles, or restraint poles is essential for safety. For instance, aggressive dogs may require a muzzle to prevent bites, while stressed cats may benefit from a towel wrap to limit movement. However, restraint should never cause pain or excessive fear, as this exacerbates the animal's distress. Psychological techniques such as using soothing tones or pheromone sprays can also help manage stress, ensuring the animal associates handling with positive outcomes, such as treats or gentle petting, can gradually reduce aggressive tendencies, leading to safer interactions in the future. Mr. Thomas is asked to restrain a frightened cat for an examination. The cat is hissing, arching its back, and showing signs of aggression. How should Mr. Thomas approach the situation to ensure safety and minimize distress for the cat? Answer: Mr. Thomas should first assess the environment and reduce stressors like loud noises or bright lights. The cat's aggressive signals, hissing and arching, indicate fear, so approaching slowly and avoiding direct eye contact is critical. Using a towel or blanket to restrain the cat gently is an effective method. This provides physical control while preventing the cat from scratching or biting. He should wrap the towel snugly around the cat's body, leaving only the head exposed if necessary. Speaking in a calm tone and using pheromone sprays can further ease the cat's anxiety. If the cat continues to resist, Mr. Thomas might consider using a cat muzzle to prevent biting while maintaining a firm yet gentle hold. Any physical restraint should be combined with reassurance, such as stroking the cat's head if it tolerates contact. After the procedure, offering a treat or a safe place to hide helps the cat recover and associate the experience with a less threatening outcome. This combination of environmental management, physical restraint, and psychological reassurance minimizes distress while ensuring safety for both the handler and the cat. Why is it important to tailor feeding requirements based on an animal's life stage, and what are the potential risks of not doing so? Answer: feeding requirements vary significantly based on an animal's life stage, as each stage has unique nutritional demands. For instance, puppies and kittens need high-calorie diets rich in protein and calcium to support rapid growth and development, whereas senior animals require lower-calorie, easily digestible diets to prevent obesity and maintain organ health. Failing to tailor feeding to life stages can result in severe health consequences. Feeding a high-calorie diet to a sedentary senior dog can lead to obesity, which increases the risk of diabetes, arthritis, and heart disease. Conversely, providing an adult maintenance diet to a growing puppy can result in nutrient deficiencies, stunted growth, or developmental issues such as skeletal deformities. Age-specific diets also address other needs, such as joint supplements for older animals or fortified formulas for pregnant and lactating animals. Providing the correct diet requires understanding the animal's age, breed, activity level, and any pre-existing conditions. Using veterinary-recommended feeding guidelines and performing regular health checks ensures that dietary adjustments are made as needed, promoting optimal health and preventing long-term issues. Explain the role of positive reinforcement in modifying undesirable animal behavior. Provide an example of its application. Answer: positive reinforcement involves rewarding desired behaviors to encourage their repetition. This method is highly effective because it creates a positive association, motivating animals to behave in a way that earns rewards. For example, giving a treat, verbal praise, or affection immediately after the desired action reinforces the behavior. Timing is crucial in positive reinforcement. The reward must be given within seconds of the behavior to ensure the animal associates the two. For instance, if a dog sits on command, offering a treat right after reinforces the connection between the command action and reward. This technique is especially useful for correcting undesirable behaviors. For example, if a dog jumps on people for attention, training it to sit instead and rewarding the sitting behavior shifts the focus to an acceptable alternative. Over time, the dog learns that sitting results in positive outcomes, whereas jumping does not. Consistency and patience are critical, as behavior modification is a gradual process. Positive reinforcement avoids the stress and fear associated with punitive methods, fostering trust and a stronger bond between the animal and the handler. How can a handler safely approach a large aggressive dog without escalating the situation? Answer: safely approaching a large aggressive dog requires a calm, strategic approach to avoid provoking the animal. Observing the dog's body language is the first step. Signs like growling, raised hackles, or a stiff posture indicate heightened aggression. Handlers should maintain a non-threatening demeanor by avoiding direct eye contact and keeping their body turned slightly sideways. This reduces the dog's perception of threat. Speaking softly and using a low calm tone can help soothe the dog. Handlers should move slowly, staying outside the dog's flight zone to avoid triggering a defensive reaction. Using a barrier such as a leash loop on a stick or a crate ensures safety during the initial approach. The handler can toss a treat or toy near the dog to create a distraction and build trust. If the dog allows closer contact, the handler should use a sturdy leash and properly secure the dog before proceeding with further interaction. Patience is key. Rushing the process can escalate aggression. Using a muzzle for additional safety may be necessary but must be applied without causing additional stress. These steps prioritize both the handler's and the dog's safety while de-escalating aggression. Mrs. Carter owns a Labrador Retriever, Max, who has become noticeably overweight. She feeds Max twice daily but frequently gives him table scraps and treats. Max also has limited exercise due to her busy schedule. What steps should Mrs. Carter take to improve Max's health? Answer: Mrs. Carter must take a multifaceted approach to address Max's obesity. First, she should stop feeding table scraps, as human food often contains excessive calories and unhealthy ingredients for dogs. Instead, she can provide low-calorie, dog-safe snacks such as carrots or apple slices as treats. Next, she should consult a veterinarian to determine Max's ideal weight and caloric needs. Based on this assessment, she can switch to a weight management dog food, which is specifically formulated for overweight dogs. Meals should be accurately measured using a food scale to ensure portion control, adhering to the recommended guidelines for Max's weight and activity level. Regular exercise is also essential. Mrs. Carter should gradually increase Max's physical activity, starting with short daily walks and eventually incorporating more vigorous activities like fetch. To monitor progress, she should regularly weigh Max and assess his body condition score (BCS). Adjusting the feeding and exercise plan as necessary ensures sustained weight loss. By implementing these changes, Mrs. Carter can help Max achieve a healthy weight, reducing his risk of obesity-related conditions like arthritis and diabetes. Why do ruminants require a diet high in fiber, and what are the potential consequences of feeding them a low-fiber diet? Answer: Ruminants, such as cows and sheep, have a specialized digestive system designed to process fibrous plant material. Their multi-chambered stomach, particularly the rumen, contains microorganisms that ferment fiber, breaking it down into volatile fatty acids (VFAS) that serve as their primary energy source. A high-fiber diet is essential for maintaining healthy rumen function. For instance, forages like hay and pasture provide the roughage needed to stimulate chewing and saliva production, which buffers rumen pH and prevents acidosis. Feeding ruminants a low-fiber diet disrupts this balance. High-concentrate diets, such as excessive grains, can lead to rapid fermentation and acid buildup in the rumen, causing ruminal acidosis. This condition damages the rumen lining and reduces feed efficiency, often resulting in decreased milk production in dairy cows or weight loss in beef cattle. Additionally, inadequate fiber intake may cause reduced cud chewing activity, leading to digestive disturbances like bloat or displaced abomasum. Ensuring ruminants have consistent access to high-quality forage and monitoring their diet composition prevents these issues, supporting optimal health and productivity.